Hello everyone, welcome back to my channel. Today I am going to explain all the phases of a contrast CT scan starting from topogram, plane scan, arterial phase, portal venous phase and finally the delayed phase. If you are a radiology student, technician or medical learner, this video will make everything crystal clear. First, topogram, scout view. Before the actual CT images are taken, the scan begins with a topogram, also called scout view or scanogram. This is a single long X-ray image of the entire body part. Why do we take a topogram? To plan the scan area, to select start and end points, to position the patient correctly, to confirm which organs need to be covered. It is almost like taking a photo before starting the real scan. Second, plane scan, non-contrast scan. After the topogram, the next step is the plane scan, also known as non-contrast CT. In this step, no contrast dye is injected. What do we look for in plane scan? Stones, kidney stones, gallstones, classification, fat density, baseline appearance of organs, etc. The plane scan is very important because contrast can hide some things. So we always compare plane scan with later phases. This is a plane view scan. Third, arterial phase. After contrast injection, the first phase is the arterial phase. We usually scan through 15 to 25 seconds after contrast injection when the arteries are fully of contrast. Best seen, aorta and major arteries, active bleeding, hypervascular tumors, pancreatic and renal arteries. Important note, arterial phase timing is not fixed. It can change depending on the patient's heart rate, IV cannula size, injection speed, that's mean flow rate, machine settings, patient's cardiac output. So 15 to 25 seconds is an approximate guide, not a strict rule. Arterial phase. Fourth, portal phase. Next is the portal phase, usually done at 40 to 50 seconds after injection. By now, contrast reaches the portal vein and fills the liver, best liver lesions, portal vein thrombosis, spleen and pancreas, intestines and abdominal organs act. Portal timing is not fixed. Some scanner might capture it at 40 to 50 seconds depending on patient circulation, body size, injection speed, scanner algorithm. So timing varies from patient to patient. Portal phase completed. Fifth, venous phase. Next is the venous phase, usually done at 60 to 70 seconds after contrast injection. By this time, contrast has moved from arteries, capillaries into the systemic veins, giving a more uniform enhancement of the abdominal and soft tissue. Best seen, soft tissue structures, whole body veins, lymph nodes, tumors and masses, chest, abdomen, pelvis, evaluation, etc. Important note, venous phase timing is not fixed. Some scanners might capture it at 60 to 70 seconds, others at 80 to 90 seconds depending on patient circulation, body size, cardiac output, injection speed, scanner algorithm, etc. So timing varies from patient to patient. Delayed phase. The last is the delayed phase, usually done 3 to 5 minutes after contrast. By this time, contrast washes out from blood and enters tissues. Best seen kidney tumors, urinary tract, cyst versus tumor, scar tissue, adrenal lesions, etc. Even delayed phase timing is not fixed. Some protocols may use 2 minutes, other 8 minutes depending on the purpose. Always remember, contrast timing is variable, not absolute. It changes according to patient physiology and scanner protocol. Example for clarity. Imagine a liver tumor. In the plain scan, it may not show clearly. In the arterial phase, it may enhance. In the portal phase, liver becomes bright and the tumor becomes darker. In the delayed phase, contrast washout helps diagnose the tumor type, but the exact timing can differ for every patient. So friends, this way the complete explanation of CT topogram, plain scan, arterial, portal, delayed phases plus why timing is not fixed. If you like this video, please like, share and subscribe to support the channel. Comment below what CT topic you want next, contrast type, MAS, KVP, windowing or CT artifacts. Thanks for watching. See you in the next video.